Mental health is a complex field. It deals with thoughts, emotions, and behaviors. Culture plays a large role in shaping these aspects of our lives. To provide effective mental health care, we must understand the cultural backgrounds of our patients. Culture influences how people experience and express distress. It affects their help-seeking behaviors. It also shapes their views on mental health treatments. Ignoring cultural factors can lead to misdiagnosis and ineffective treatment plans. Imagine a doctor who doesn't speak the same language as their patient. Communication barriers can hinder diagnosis and treatment. Similarly, cultural differences can create invisible barriers in mental health care. By recognizing the importance of culture, mental health professionals can build trust with their patients. This understanding leads to more accurate diagnoses and better treatment outcomes. The DSM-5-TR is a guidebook used by mental health professionals to diagnose mental disorders. It recognizes the crucial role of culture in understanding mental health. The DSM-5-TR introduces the term, cultural concepts of distress. Cultural concepts of distress refer to the ways different cultures experience, understand, and communicate suffering. This concept recognizes that mental distress is not always expressed in the same way across cultures. For example, some cultures may express sadness through physical symptoms like fatigue or headaches. Others may express anxiety through social withdrawal or anger. Understanding these cultural nuances helps mental health professionals to accurately assess and diagnose mental health conditions. It allows for a more holistic and culturally sensitive approach to patient care. The DSM-5-TR moves away from the outdated term culture-bound syndromes. This term implied that certain mental disorders were confined to specific cultures. Instead, the DSM-5-TR introduces three new distinctions: cultural syndromes, cultural idioms of distress, and cultural explanations. Cultural syndromes are clusters of symptoms and attributions that tend to occur together within a specific cultural group. These syndromes may not fit neatly into the categories of mental disorders outlined in the DSM-5-TR. Cultural idioms of distress refer to culturally specific ways of expressing distress. These can be words, phrases, metaphors, or narratives used to describe suffering. They may not directly correspond to specific mental disorders. Cultural explanations are culturally recognized meanings and explanations attributed to symptoms, illness, or distress. These explanations often draw on cultural beliefs and values. They provide context for understanding the individual's experience. Cultural syndromes are found in various cultures around the world. They reflect unique ways of experiencing and understanding distress. Here are a few examples. Ataque de nervios, often seen in Latin America and the Caribbean, is triggered by stressful events like family conflicts or death. Symptoms include uncontrollable shouting, trembling, crying, and feeling out of control. Susto, common in Latin America, is believed to be caused by a frightening experience that causes the soul to leave the body. Symptoms include insomnia, restlessness, depression, and social withdrawal. Taijin Kyofusho, found in Japan, involves an intense fear of offending or embarrassing others through one's physical appearance or actions. It often manifests as social anxiety and avoidance. Section 5. Cultural idioms. Expressing distress differently. Cultural idioms of distress highlight the diversity in how people communicate their suffering. These idioms often use metaphors or culturally specific language to convey emotional pain. For example, in some cultures, people may describe depression as feeling heavy or having a weight on their chest. In other cultures, sadness may be expressed through somatic complaints like headaches, fatigue, or stomach problems. Understanding these idioms is crucial for mental health professionals. It helps them to bridge the communication gap between cultures and understand the patient's experience more fully. Section 6. Cultural explanations finding meaning in context. Cultural explanations provide a framework for understanding the causes and meanings attributed to illness and distress. These explanations often draw on cultural beliefs, traditions, and spiritual practices. For instance, in some cultures, mental illness may be attributed to supernatural causes like witchcraft or spirit possession. In other cultures, it may be viewed as a result of social conflicts, family problems, or karma. Understanding these explanations is essential for providing culturally sensitive care. It allows mental health professionals to acknowledge and respect the patient's beliefs and values, even if they differ from their own. Section 7. The cultural formulation. Interview, a roadmap to understanding the cultural formulation interview, or CFI, is a tool provided in the DSM-5 TR. It helps mental health professionals to gather information about the patient's cultural background and its influence on their mental health. The CFI is structured around 4 key domains. First, cultural identity of the individual. This domain explores the patient's sense of belonging to different cultural groups. It includes questions about language, ethnicity, race, religion, and other cultural affiliations. Second, cultural explanations of the individual's illness. This domain examines the patient's understanding of their illness. It explores cultural beliefs about the causes, symptoms, and treatments for their condition. Third, cultural factors, related to psychosocial environment and level of functioning. This domain investigates the impact of culture on the patient's social support, stressors, and daily functioning. And fourth, cultural elements of the relationship between the individual and the clinician. This domain focuses on the cultural dynamics between the patient and the clinician. It explores potential differences in communication styles, values, and expectations. Section 8. Adapting the CFI, meeting diverse needs. The CFI is designed to be flexible and adaptable to different cultural contexts and patient populations. For example, there are specific variations of the CFI for children and adolescents, older adults, refugees, and immigrants. These adaptations take into account the unique cultural experiences and challenges faced by these groups. The goal of the CFI is not to provide a one-size-fits-all approach, but rather to offer a framework for culturally informed assessment and treatment planning. Section 9. The power of cultural competence. Better care for all. Cultural competence is not just about knowing facts about different cultures. It's about approaching each patient with curiosity, empathy, and a willingness to learn from their unique experiences. By incorporating cultural understanding into mental health care, we can improve the accuracy of diagnoses, develop more effective treatment plans, enhance patient engagement and satisfaction, and reduce health disparities while promoting health equity. The DSM-5 TR's emphasis on culture represents a significant step forward in providing culturally competent mental health care. It highlights the importance of recognizing and respecting cultural differences to improve the lives of all individuals seeking mental health services.